And we're back here, BMO Harris Bank pregame live. We're at the United Center for the Bulls and the New Orleans Pelicans. It's game 41. Bulls come in 19-21, the Pelicans 16-24. Welcome back, everyone. Courtside here underneath the East Basket. I'm Steve Kashul. So I'm going to be joined by Dr. Adam Yanke. He is the head team physician for the Windy City Bulls, the Bulls affiliate in the D-League, the Developmental League, as the Bulls are about to take the court here. Right behind us, smoke in the air. Dr. Yanke, thanks so much for joining us. So congratulations, because you were recently named for this year the head team physician for the Windy City Bulls. We're so happy to have them playing at the Sears Center in Hoffman Estates. Tell us about your new role.
Yeah, thanks for having me. It's really been great. So like you said, I'm the head orthopedic surgeon, but there's really more than just me. So Arnold Lee is the head athletic trainer, and Jeremy Allen is the head primary care doctor. And it's been a really good integration because this is a team dedicated to the NBA team for the Bulls. And so there's a lot of interplay between the two, not just for the players, but also for the medical staff, the coaching staff, the athletic trainers. And so it's really been a good training ground and proving ground for a lot of different people.
You guys are all from Midwest Orthopaedics at Rush. You do such a marvelous job. And talk a little bit about that, Dr. Yanke, the importance of having a large staff, and you can rely on each other. Dr. Brian Cole, of course, the head team physician for the Bulls. You're close to him, and so I'm sure you guys share a lot.
Yeah, it's great. I mean, Dr. Cole and I have known each other for almost 15 years, and so he's been working on exposing me to this environment, so that's helped me a lot. And I think all of us have those same mentors that are with the Bulls that have helped us now with the Windy City Bulls. So Dr. Kathy Weber has been helping our primary care sports doctor, and that's been really great. You can't do any of this stuff alone, and so that's why we have our therapists, the athletic trainers, pharmacists, primary care doctors, surgeons. I mean, we all try to do what we do best, and I think that the more people you have involved, the better it is.
Dr. Adam Yanke joining us from Midwest Orthopaedics at Rush, the head team physician for the Windy City Bulls, and also helps out with our parent team here, the Chicago Bulls. Dr. Yanke, tell us the differences maybe in your role with the Windy City Bulls compared to what you do with the Bulls here.
Yeah, so there's definitely some similarities, and during game time itself, it's basically the same. The biggest difference is what happens after the games and then the level of involvement. So with the Windy City Bulls being a head physician, you're really hearing what's going on with the team every day, constant communication with the athletic trainer. Whereas here, when you come in, Dr. Cole and Dr. Weber are really spearheading everything. And then we make sure that we're managing anything that goes on tonight, and then we communicate that with him and the athletic training staff and make sure that there's good continuity of care there. But it's just the difference of having that daily involvement versus the game involvement.
And you're kind of on 24-hour call then, aren't you, with the Windy City Bulls? That changed your life a little bit?
Yeah, you know, there's some expectation there that you're available, and I think it's good, and I think that we know that coming in, and so it should be something that you enjoy and that you find fun, and so I think that's why we all do it.
Fantastic. You specialize, Doc, I know, in shoulders, knees, and cartilage restoration. Explain what that is, the cartilage restoration part.
Sure, so it's good for patients that have basically a pothole defect opposed to needing the whole road resurface, which would be widespread arthritis. So we work on trying to revitalize or reestablish small focal areas of loss of either the meniscus or the lining of the joint called the cartilage. And it's a more involved process, but it's better than metal and plastic, we think, like a knee replacement when it's indicated.
Yeah, and you guys have come a long way, haven't you? I mean, there's so much science and research now compared to the last 5-10 years, and what you're doing Midwest Orthopaedics at Rush. I mean, you guys kind of pride yourselves on that as well, don't you?
Yeah, we love it. I mean, we're really interested in it. We're privileged to have a lot of exposure with it, and so we do clinical studies, basic science animal studies, lab studies, and hopefully they're all translational, so we actually take this information, turn it into something that's actually going to help patients, not just publish a paper. We want to actually see the difference in our clinical practice.
Dr. Adam Yanke is with us for another minute or so from Midwest Orthopaedics at Rush. He's the head team physician for our Windy City Bulls of the D-League. And any basketball-specific injuries you can tell us about? I mean, are there some common injuries that you see with the basketball players compared to other sports?
Yeah, so, you know, certainly the knee injuries are the highest on the list, as well as ankle. There's some finger injuries as well, just from stubbing their fingers from getting hit with the basketball or another player. The most common lower extremity injuries we still see are still tendonitis, and so peroneal tendonitis, pes tendonitis, which is part of the hamstring muscles. Then there's the bigger injuries, which are the meniscus and the ligaments of the knee. Those are the ones that we really have to watch out and try to prevent also.
Yeah, and you, I know, work with not only the professionals, but also the younger generation, right? We're seeing more and more overuse injuries. We talk about that a lot.
That's right.
Yeah.
No, it's important. I mean, there's not as strict guidelines in basketball like there is in baseball to prevent elbow and shoulder injuries, but we do think that obviously appropriate warm-up, stretching, and then making sure that we don't have fatigue-related injuries is really important for basketball and lower extremity injuries.
Wonderful stuff. Dr. Yanke, thanks for joining us here on our pregame show, and congratulations on your appointment as the head team physician, and it's good to have the Bulls and the Windy City Bulls in good hands.
Thanks for having me.
All right, Dr. Adam Yanke, Midwest Orthopaedics at Rush. When we return here on our Bulls pregame show, I'll be rejoined by Bill Wennington. We're getting ready for Bulls basketball this afternoon. It's the Bulls and the New Orleans Pelicans. Thanks for watching us on Bulls TV. Coverage continues with more on WLS AM 890 and the Chicago Bulls Radio Network.